Well, good afternoon, everyone, and thank you for joining our live Q&A session with Care at Home Services. I would like to give a warm welcome to my guest panellists, Maggie Edwards, the owner and director of Care at Home Services, and her care coordinator and scheduler, Laura Glynn. Welcome to both of you today.
Thank you.
We are broadcasting from the beautiful area of Naas in County Kildare in Ireland, and for the listeners, you can use the chat function in the webinar to post a question to Maggie and Laura as the session progresses, and we will try and get to as many of them as possible at the end. So Maggie, let me start with you. Tell us a little bit about the history of Care at Home Services and why you started this company.
Well, back in 2004, I was what you call a registered public health nurse here in Ireland, and very quickly I realised that home care was very poorly provided in the country, and indeed probably not relevant. However, so I commenced Care at Home Services with in mind with providing a home care services of quality, and probably at that time nurse-led, moving and developing on to a more traditional home care style service. And really, probably the focus was quality, really, and to be able to deliver in all the geographical areas of County Kildare and West Wicklow. So that was my brief originally.
So bring us forward now to the summer of 2015. What was happening in the business and what were the challenges you were facing?
Well, home care evolved over the period, in that 10-year period. It had grown, the industry had grown a lot, and with that, the recognisation from the Health Board in Ireland and the introduction of what we now know as home care packages. So the emphasis was there, and also the funding was there. So my service grew very quickly, and with that there were tendering opportunities with the Health Board, which we pursued and were successful on all those occasions. So suddenly I found myself in 2015 with a very large workforce delivering quality care all over the county, as I say. But really I wanted to improve that. I wanted to my brief was that I wanted proof of attendance. That was very important to me, and it was important to the funding agents as well. So, the most important thing with that brought along scheduling.
Yeah.
Because scheduling then, I'd gone from 10 to 20 carers to 60 plus carers. So again, at that point, we were doing it on Excel, which was very complex, extremely time consuming. There was a large margin for error there, and all of these things caused me a lot of consternation and concern. And so therefore in 2015 I decided that I'd look for a scheduling system that would provide quality, proof of attendance, and would have ease of use and ease into the introduction into my business. So that's how I came upon NurseBuddy.
Very good. And so bring us back to those critical elements of cloud-based software that had to work for you. What were the elements that needed to make a difference and quickly to the business?
Well, I suppose it was scheduling. Scheduling was the first and foremost point that I needed to address. And so that's one. Two, very important, proof of attendance, GPS tracking of staff. Obviously, as the business grew, I was less able to ensure all of those things manually. So this particular system provided all those elements to me.
Okay. What were your fears and concerns about moving over to a digital system?
Initially, the transition period, I was very worried about that because I've become very dependent on my paper scheduling system, which was a poor system, but I had become very dependent on it. So I had to take a big deep breath there and take a big leap of faith and move forward. So that we did. I suppose the other thing that was worrying during that period was I was having to let go, loss of control, as I felt, and I was very worried that I'd have a system failure, and if I did, how did that impact on my business? But as you know, that was never an issue.
Okay. So now that your decision was made, when you introduced the idea of using a mobile app to the staff to report from their visits instead of timesheets, what was their reaction?
Surprisingly very good, and very little opposition to that or consternation. The removal of timesheets was a huge attraction to them. And Laura and I discussed this only yesterday, and we just even reviewed a new carer starting yesterday, and thinking about, how quickly we could get this individual on the system, and from start to finish it was 3 minutes. So
that's pretty startling. It really speaks for itself.
That's the reality of it. And once they've left the office after being put onto the system and shown how to use the app, they're gone. And we very rarely get problems. And if we do, it's addressed very quickly. Those genuinely are no issues there.
Okay, so you mentioned there they liked the idea immediately of the removal of timesheets. Was there anything else that you needed, that you liked about the system, that to win them over? What else did they resonate?
I think at the time we were very fortunate in that there was a changeover with mobile phones. I mean, 10 years ago, a lot of my staff would have been using Nokia phones, which were only really being able to make phone calls and text messages. And we just into 2015, most people were moving on to Android phones.
Yeah.
So there was a natural progression there, which made all of this very easy. So indeed, when we did put people onto the app, we only probably had 2 or 3 people that weren't able to utilise the app. And you still do have a straggler. We have 1 or 2 that still like their Nokia, and that's not a problem because we can manage 1 or 2, but we can't manage 60 plus.
Yes, that's true. Let's turn our attention then to the first few months, this new way of working, this central system. What were the first meaningful differences that you noticed? What do you think was the key to the success of the system in that first period?
It took away the risk of double bookings, which were a cost to us, and that was because of human error. So we were sending 2 carers to a house instead of 1. The other greatest hurdle for us was missed visits. So overnight, really, we had eliminated both those elements. So that was huge for us, and of course, at the beginning, it's a slight learning curve, but once you get 1 or 2 weeks in on the system, you become confident and trusting of the system, and then you realise it's reliable, and so now I can work off site with my little tablet and enjoy a meal, and I have access to all the information from the office that I need.
And that's exactly where we were leading into the next question. If we fast forward to the present day, so you're now 18 months approximately using NurseBuddy, how do you feel about where the business is now as a result of the platform?
Wow, it's been wonderful because it's made my business much more manageable. It's cost effective. I'm down on admin time. I've got reliability, I've got security. The 18 months has reassured me that, I haven't had system failures, the great things I was worrying about. So those are the practical elements of it. All my staff data I'm really becoming paperless because of it, because we're uploading as much as possible. So that's great. Off-site, on call in the evenings, all we have is a little tablet at our side. Should somebody call, we can immediately locate where the carer is, what the client's contact details are, what their care plan. So that's just terrific. So yes.
Sounds like it's been a huge reduction in stress, not to have to be in the office all the time to tackle the small problems that come up day to day?
Absolutely. I mean, my working day would be very early in the morning, and often I wouldn't finish till 9 o'clock. We absolutely, short of gossiping in the office, we're out by 5:30, which is great. And so that's wonderful. But the other side of NurseBuddy, in terms of the system for me, in terms of, I mentioned earlier that I went to tender at the tendering process stage, it really ticked a lot of boxes for me. I could give proof of attendance by my carers. I could identify what tasks and activities they've been doing. I could look at the duration for invoicing purposes. And also, the amount of data that I can extract from NurseBuddy in terms of statistics, and in terms of invoicing, we can see who got a service when. So invoicing became very, very much easier and streamlined. And again, from doing the wages, our wage clerk can go on and she can go through each individual carer's working week and extract how many visits they've done and how many, in terms of minutes or hours they've done. We can. So that's been wonderful. And the other thing is with NurseBuddy is that from a quality point of view, I can book in things like carer reviews, client reviews, supervision visits, spot checks. And again, if I have an audit from the health authority, I can illustrate this. That they happened, and they happened in real time, and they're completed by whoever.
That's a really interesting point that you bring up. How you prepare and manage the inspections and the audits from the health authority. How has it made a difference even in preparation time, just to know that everything is in one place?
Well, for a start, they may well ask us on referral of a client to us, they want to see a schedule. So I can give them a template schedule of that client's visits for the week. So quickly I can do a snap of it and email it to them, so they have that there. And if they have any queries about an invoice, I can go back and snap it as well. So so we have that facility there. So it's very reliable from that point of view.
Okay, excellent. And Laura, so to turn our attention to you now, this is a great point to hear your thoughts. As Care at Home Services care coordinator and scheduler, when did you start and what's involved every day in your role? What's a day in your life?
I started with Maggie in March of last year. Previously to that, I had a small bit of office experience, but absolutely no schedule experience. But with NurseBuddy in the system, it was so easy to pick up. It's a simple layout of the system that makes it very easy for anyone to follow. Even if you're not very good with computers or anything like that, in terms of that, it's not really a problem because it's self-explanatory nearly. And also I found when I started out, the help buttons, what's new on NurseBuddy and how to use things as well, was very efficient in helping me kind of prepare what needed to be done on the system.
So really, you were teaching yourself how to use NurseBuddy, it sounds like.
Exactly, yeah. When I came, it was just Fiona was with us. She was a previous care coordinator at the time. But, she was busy enough doing other things. And the fact that I was able to train myself in it by just sitting there and using the system and getting used to the system, it's simple enough to do that. It's not rocket science. It's a great system in that sense.
Okay, that's really excellent. So how important do you think NurseBuddy is in managing your everyday workload? Like, how does it help to simplify your work?
Well, one of the best things about it is the real time and the way that the rosters are app-based. So, previously to this, if there had been a change in rosters or, somebody went out sick, there'd be, a huge amount of phone calls that would have had to be made, and can you do this and can you do that? Whereas now, I can go to NurseBuddy, I see who's out, and I can move things around and slot things in and get everything covered. And all I have to do then is send a general message to whoever I've changed for that day, just to say, please have a look at your roster, it's been changed, and give me a call in the office if there's any problems, which is very rare, because most of the time, once you've done the changes, and if it's not, if they're already out, they don't really give out too much. Whereas if you had to put a phone call in there, you're nearly begging people to do it, that kind of way. So it takes that element away. So it's time saving, and I don't know how to put it. It would be kind of saving face, but you're not constantly asking for favors. It saves that side of it as well.
It sounds like communication in terms of understanding who is where.
Yeah.
Who would like to get extra shifts?
Yeah.
Where is the flexibility within your staff to adjust from day to day and within the day as well?
Yeah.
Okay. So what would be your top tips that you would share with other care coordinators who are paper-based at the moment, or using Excel and using very manual communication methods? What would you say to encourage them?
The NurseBuddy system for the scheduling, there's even a copy button, so when you're doing the rosters, when I'm doing the rosters for the following week, I can copy from previous weeks, which is an absolutely amazing function, because, that kind of, it's most of the time it's around 80% the same. So, you're saving yourself a huge amount of work there and time, and also the copy function as well is great for, it's, mistakes. It kind of saves on that, because, you're not going to have it copy into somebody who wasn't already there, because it does it on previous weeks and previous rosters that have been up on it. And it also, specific carers for specific clients, and no-go carers. Like, that's a great function on NurseBuddy, where you can allocate, clients that don't want certain carers for an abundance of reasons. It allows you to. It's like a protection. That it's noted there and you see it. If you go to do that.
So it sounds like it really gives you, as the scheduler, peace of mind that when all of your client requirements are taken into account, the system recognises those. It helps you and safeguards the delivery of that care and those requirements.
And also I find it great then as well, because we have such a high volume of requests, and for certain days off, for holidays coming in, I find it's very useful in the fact that you can just pop in those requests, straight onto NurseBuddy. That you don't have, tons of bits of paper flying around with this date and that date. It's all on the system. You can't miss it when you're doing the rosters. It's there for you. You're not going to make the mistake of putting them out the day they requested off, which also helps with, getting on with the carers from a management point of view, because, they feel that they were thought of, they were remembered, you didn't just forget them, so that's a really positive side to it as well.
Yeah, and it leads me really well into the next area, which is staff engagement. So again, now that the staff that have been with you long term, they're 18 months using the NurseBuddy app, how do they feel about it now? Does it contribute to their overall happiness in their role?
I genuinely think that they, we don't hear much. They don't come on and tell us that they love it, but you genuinely, when you don't hear from them about something, it means they're happy with it. So, and I feel that they like to have all the information there at hand, because, it's kind of a security for them that, anything I need to know is there, that kind of a way. And I think that the communication, the way they can just, pop in a message, or a notification to us through NurseBuddy, through their visit and what they've done, it's less time consuming for them, even putting a phone call in about tiddly little things that don't really matter, but that in the overall view of the client, maybe something that everybody should be aware of. So instead of having to make all those calls and all of that. It's all on the system, on the client's profile, and it's data protected as well, which is great because, you know, if a client, if a carer doesn't visit a client, then they can never see their profile, you know, which is brilliant because obviously that's something that can't really go on.
And I think the other, that's interesting what you just said, Laura, but I also think my carers feel very professional with their app because it gives them great credibility, and there's a lot of buzz around the app. It certainly was 18 months ago, and even to now, you know, that our clients are very impressed by the fact that my carers carry this cloud-based app, and that they have to log in when they come in, and they have to report what they're doing, and then they have to send a communication should they wish to, and then log out. And I think that has a knock-on effect. I think the carers feel that, you know, they're in control, which they are, and I think my service users and their families as well see us, you know, we've probably developed a better professional image, and the fact that we, you know, have moved into this technological space, and again, I think from our funding agents, they see that as an investment into the company in terms of quality, you know, and that so I think yes, the staff certainly like it, and to date we've had no problems with them.
That's really excellent. Tell me about when it comes to taking on new staff. Does the idea of paperless reporting and managing their time and attendance make a difference to recruitment?
I think their experience with other companies is all of what you've just said. And I think once we introduce them into this app and that the system of way, the burden of all of that is taken off them. And I think, you know, because it's easy to use, it's simplistic to use, it's live, you know, real time. They can look at as soon as the rosters go live, you know, on Friday or a Saturday morning, they've access to them, you know, and that indeed they can see, should we wish to do them 2 weeks, 3 weeks in advance, they can have access to them. And I think they really like that. They don't have to have an email address. You know, some people are not computer illiterate, you know, so having their app actually just, you know, most people are working largely off their phones now. You know, they're doing they're not necessarily looking at a computer. So the fact that they don't have to log on and, you know, open an email, all of these, and return a timesheet by attaching it, filling it in, they see that as a chore. So this has taken all those chores away from them. So once they finish their shift, they log out, and they don't have to address it until they go to work the next day.
Very good. So finally, we've nearly come to the end, and I was thinking of, Maggie, how the system, if you had a comment on how the system has helped you to plan for the future and implementing business development plans, for example.
Well, the system has helped me manage my business effectively and efficiently, and it's proved to be cost effective and reliable. And the most important thing, if I was to conclude, is that you know, I can use it off site. I can manage my business off site, and that is just powerful for me. I mentioned earlier, alluded to it, gives me the business image is much more enhanced. Okay, my quality, I can demonstrate quality better. That's very, very important to us. And also, when we go to contract or tendering, this is a wonderful tool. I use it for data analysis. I use it for looking at compliance, carer compliance, see if their training is up to date, and if indeed when it needs to be refreshed, we can put a date down the line for it to alert us. So all of these elements have been key, and they make the day-to-day running of the business easier. So as we grow, as the business grows, we take on more clients and more carers. All we do is input that on that given day and plan forward. So therefore, we're not constantly going through files, checking as they're up to date. We know once we've entered it into the system, we'll be alerted down the line, so it takes that anxiety off it.
Okay, very good. That's really excellent. So I want to turn over to our audience now and see if there's any questions. So we have a question from Mark. he was asking, what did you feel that there was, when looking back to the beginning, was there any other solutions apart from, a cloud-based software that you thought could do just as much as this does, or did it really stand out?
I did look at other systems. I found them rather complex and arduous, and I'd certainly looked at them probably 2 or 3 years previously. That probably put me off a little bit, because it was the implementation of that seemed to be a huge task. So that when I did look at NurseBuddy, what jumped out at me very quickly was the simplicity of it.
Okay.
And for me, it had to be simplistic for me to implement into the business swiftly and without causing any consternation to my clients, my staff, or myself. And that going forward, that my carers would have ease of use and the operator scheduling would have ease of use. And it ticked all of those boxes.
Okay, that's excellent. And we've one other question just in relation to preparing for inspections and the health authority. As we know, this is a really big pain point for our customers in Ireland and in England, throughout England. And is there any other advice or top tips that you would give to business owners and how to utilise your platform to prepare for inspections?
Well, with every new client, obviously upload as much information as you can in relation to their service, i.e. their care plans, their risk assessments, any changes to that paperwork. You need to refresh and upload. So it's on the system there, and build into those documents review visits or review time scales. The system will allow you to do that. Yeah. And the same with the carer. So you have a carer, you upload all those details, you enter all their qualifications and compliance qualifications that they need, and plan them for down the line so that they're all very visible on the system. You can even record carers' sick leave, which is great. So somebody rings in sick today, you can immediately put them on the system. On a click of one button, say Sarah is off sick here today for X reason for this period of time. So you can look back and review, in terms of what holiday they've had, what sick leave they've had. So when you have staff appraisals, you can quickly click onto their profile and you can see what's been happening over the course of the year.
So it sounds like it's very much aligned with the mantra of you get out what you put in.
Yes.
So it's, if you use it as much as you can, that information will be visible. That will be there for you to share when the time comes.
Yes, and even today, even 18 months on, we haven't used half the system, really. We've still a lot more room to be adding onto the system. But, of course, we're a growing business, so, these things evolve,
And we've one more question from Nicola. Is when you are notifying staff of changes, Laura, do you use the notification function to reach one carer as well as a group of carers?
Yeah, so it would depend on how, for example, earlier on this morning there, we had a carer who was out sick for the weekend, and I changed about 4 girls' rosters, and I send a generic general message. I just added the girls' names in the SMS center, and click them in and just say, that I have changed your NurseBuddy roster for Saturday and Sunday. Please have a refresh of your app and check your rosters. And, any problems, get back to me. And majority of the time they don't get back to you, because majority of the time they're out anyway. Yeah. But it saves very time consuming. You can also, I use the message center as well for, for all teams. So if I wanted to send out, let's say, we had something about infection control and we wanted to, notify everybody about a certain thing, I can send it to all the teams. I can send them all the one message from NurseBuddy. So it actually saves on emails as well. And the other thing is that when we send a message off NurseBuddy to them, they receive it as a text message. So, you're not relying on them checking email to know that they've seen it. You know, if a text has been sent, it's more than likely going to be looked at immediately. Do you know, it's a text message. So
Sure.
yeah, so it's a great benefit to it in that way. You know.
I think if I was to sum it up in general, I think the stress levels in my business plummeted. Okay, I think everything seemed to be better organised, you know, and we had options, you know, and I think Laura alluded to it earlier, you know, number of telephone calls diminished. We had a new care coordinator start with us before Christmas, and she couldn't believe how quiet our office was.
Yeah.
That was the case, wasn't it? And that was simply because the system facilitates that. The communication, you know. So the girls weren't having to ring up and say, I'm outside Mrs. Maguire's house, nobody's answering the door. They have all the details on their app. You know, they have their client's telephone number, next of kin, they might have the key safe number, they might have the neighbour's contact number. So, you know, they can take the appropriate action on the doorstep without having to pick the phone up and ring us. And it's only when they've exhausted all of those avenues that they'll ring us. Yeah. But as you know, they have solved the problem.
It also gives them a sense of responsibility, you know, that it's, you know, up to them to sort it out, you know, and to come up with a solution and to try and see what they can do with the information provided through NurseBuddy for them, rather than just, you know, picking up the phone for every little thing. And it actually, starting from, you know, from them doing that with NurseBuddy, with next of kin, you know, it moved on to them finding solutions for other things that, you know, they genuinely didn't really need to ring us for, but it was a go-to, ring the office, you know, it kind of took that culture away, you know.
And the other good thing was that they can read on the app what the other carer, the last carer visiting that client, has reported. So it brings them up to speed with, you know, the welfare of the client or any changes there because the previous carer has reported that. So that brings them up to date. So that, you know, again, these are all things that are amounting to the reduction in telephone calls to the office, you know, and out of hours that, I mean, we were already having this discussion, out of hours of an evening, given that we have, you know, we'll say 100 to 150 clients, we probably get 1, max 2 phone calls an evening.
That's really a startling statistic, and it's always great to hear, you know, numbers like that. You know, it quantifies it. Well, it sounds as if carers being more informed has empowered them. So that sense of seeing all the information instantly, having it to hand, means they're doing better decision making. Okay, we have a couple of more questions. A really good one here from Louis. Maggie, how long would you say it took you to transition to NurseBuddy completely from your old way of working?
Well, that's a very good question. I can only tell you how I did it. I had 2 young girls, graduates they were, for the summer holidays, and I brought them in, and I actually got them to use NurseBuddy. And in principle, what they did was they went case by case, each client uploaded all the client's details, all the relevant documentation, and they did the same with the carers. And then the next task was to actually create visits, the actual visit times that were required. So probably for probably about 2 to 3 week period, I was still relying on my paper Excel rostering system, but my daughter, who worked with me at the time, very quickly said once we'd got the bare bones of it, we'd go live with it. I was very reluctant at the time because, you know, I was still hanging on to this control and nervousness, and she literally said to me after the 3rd week, we go live next Monday, and we allocated the visits, allocated the staff, and I never ever looked at an Excel rostering schedule again. So very quickly, but I will say that you would need help at that initial stage, uploading all the information and creating visits. That's a very busy time, and I would say that you need to set aside 2 people for that for a period of time to get it all on.
So in total, that feeling of fully transitioned was about 4 weeks.
That's being very generous. I think the key was
extra manpower
for probably a 2-week period to upload all the relevant data uploading. And
I think it was a good idea in your project to set a target. A go live date means it's a date that everybody is working towards, united. And in terms of NurseBuddy, we always help our new customers as well with extra kind of help for data import. So it's something that we've learned a lot as well ourselves, and we're doing it better and better. And finally, also from Louis, a question about the Irish healthcare system, because there is some differences between Ireland and England. Is a paper copy of the client's care plan still required to be in their home?
Absolutely.
Okay, so that would be similar to England, and that's easily done and manageable in your administration.
Currently, the health board here in Ireland are asking us to even have a login and log out paper document within the client's home. My carers do still fill that in because the health board in Ireland have still, they haven't got a lot of companies using cloud like us at the moment. They're trailing behind, so we're actually just doing both at the moment. But
and is that manageable? It doesn't cause too much duplication?
Well, no, because if we go out and do a reassessment of a client, then we do have to change the paper care plan in the client's house, because obviously the nurses are visiting, so they need to have a look at that. And also, they may want to add a comment in. They don't have access to NurseBuddy. But that brings another point, that the system does facilitate portal access by families. We have that facility as well, where the families can check in to see if a carer has attended and completed their tasks. So that's another element to this system that gives families reassurance, and of course the funding agents like that too, because it's inclusive.
Okay, so that could really be a game changer in terms of home care companies working with their health authorities, and a new way of communication and choice for the client. They have more visibility about what's happening in the care, and therefore they're more involved.
Okay. Well, that's one of their key ethos. That it's a collaborative and multidisciplinary project. So yes.
Okay. Well, we've gone through each of the questions that have come in from our listeners, and I think we've covered a lot in our chat today. And first of all, let me say a big thank you to both of you for joining us today. It's a fantastic experience for some of NurseBuddy's newer users to hear from you, are very experienced users, and are able to talk about the impact, most importantly, the impact to the business. So we'll wrap it up there. So thank you very much to Laura and to Maggie from Care at Home Services. Thank you to our listeners who have taken the time to join us today, and we will also forward you a recording of this Q&A session very shortly. But for now, I hope everyone has a great day.
Well, did you record it?